Hi, I just want to share this case with you that I had at the clinic today. Um, the owner had found this hole in 103, and in the beginning, when I saw the hole, I thought that it was just kind of superficial trauma to the tooth. But then I started poking around in the tooth with the needle, and I could see that it started bleeding. And I could also get a lot of food particles out of the tooth. Is a bit difficult to see here because of the bleeding. Um, the owner hadn't seen any problems with the horse like that, but yeah, but she was concerned because she saw this hole. And we were discussing what to do with this tooth. So I was digging a bit more around in the tooth, and as you will see now in this video, I have got a lot of food particles out now, but we see that there is a small red area down under my finger here. And when I get the needle into the hole, it starts bleeding out of this. So I guess this is a fistula from the tooth. So this is indicating that the tooth is bad, of course, and I think the strange thing with this one is that normally, if we have contact to the pulp in the tooth, in my experience, the horse reacts quite a lot when you hit the nerve with the needle. So I think there's two possibilities here: either the nerve is dead and it's just bleeding, or actually we are not in the pulp. So this horse could be a possible case for restoration. So the thing with this horse and this owner was that the owner has had a lot of bad luck lately with her horses. So we were discussing things, and we agreed that we would do this the cheapest way possible, and also the way where we kind of knew that it was very unlikely to cause any problems. If we do the restoration, there is a risk of infection afterwards. So we didn't do any radiographs. It could have been interesting just to see if the tooth had other fractures or how the apical area would look. But again, to save some money, we just agreed to extract the tooth. So after this poking around, I did the intraligamentary anesthesia, and for all my tooth extractions, that's incisors, canines, cheek teeth, everything, I always use intraligamentary anesthesia now. And I find this very interesting just because it's working very nicely. But also sometimes you see in cases like this that you see that it's draining here. So when I'm injecting my local anesthesia here, it's draining out of the hole. And we can just see that in a quick replay again. So we'll just have it here in a moment. So I find this also kind of a diagnostic tool to do the intraligamentary anesthesia, and that can be the same in cheek teeth. So you see now when I inject, you see the fluid coming out of the hole. So we know that there's a lot of stuff going on in this area. So in my opinion, it was quite okay to choose the extraction here instead of a restoration. So we did the intraligamentary anesthesia and extracted the tooth. The tooth did fracture during the extraction, and maybe because there was a fissure line or something like that from the beginning, but as we didn't have the radiograph, we don't know. But the tooth was elevated out, the rest of it. So everything was fine, and the horse was sent home with painkillers. And I never use antibiotics for these cases. So so it didn't have antibiotics. So hopefully this horse will live happy without this tooth. And we did it the cheap way this time to save some money for the owner. So thank you very much for watching.